Welcome back. This is ASICON 2018, the 48th Annual Conference of Endocrine Society of India. Well, we have a senior endocrinologist amongst us today here on ESI TV to give you some more insightful conversation coming up right next from Professor Sushil Gupta, Department of Endocrinology, SGPGI, Lucknow. Sir, hi, how are you doing today?
I'm fine.
Great. ASICON 2018 is right here with a vast spread of scientific program this year, along with interactive initiations that you must have witnessed and we would be experiencing for the next 2 days. How has the experience been so far?
It's phenomenal, fantastic, well organized, well conducted, very informative. Very good scientific sessions.
Let's talk about the evolution of endocrinology in India and what is your take as far as the current new advances are concerned?
I've been associated with endocrinology for the last 30 years. I've seen the endocrine society growing up. Initially the meeting was only 100-150 people. It has grown really big to 2 to 3,000 delegates. So it is really very happy scenario that the scene of endocrinology is growing very fast in this country, and I think it is very appropriate that to take care of the patients we need many more endocrinologists in this country.
Professor Gupta has also delivered a session in our symposium talking about osteoporosis. So what exactly is this, and could you please brief our audience?
Osteoporosis is basically a clinical situation where the bones are fragile, actually they fracture with little small amount of trauma, and therefore the fractures can happen at the wrist, at the hip region, in the backbone, and that makes you crippled actually. The backbone causes shortening of the height, and when the fracture happens at the spine, you have a backache, shortening of the height. Fracture of the hip, you already know that somebody in the family has suffered a hip fracture, they are immobile. The most important is not the fracture which matters. The almost 40% of the people die within 1 year of its fracture, of the hip fracture, because of some other medical conditions. Wrist fracture is not so detrimental, but it occurs in the earlier part of life, like 40 or 50 years, but definitely it is a real cause of concern.
Sure. So what are the consequences, or how does it affect our health?
Basically, osteoporosis causes fractures, and any fractures leads to the lot of the cost factors, actually immobilization and association of other medical situations like diabetes, pneumonia, and coronary vascular disease. They all associated with it. So that's the reason it is really very important.
So is there any way how one could diagnose this before the fracture actually happens?
Basically, osteoporosis occurs in almost 40% of the postmenopausal women, the women who have stopped their periods, almost 40%. As the age increases, the prevalence increases in the higher age groups also. The man is also not aloof actually. Almost 20% of Indian men have got osteoporosis. Again, as the age advances, more osteoporosis happens. Well, diagnosing them early is basically a public health issue actually, as we take the blood pressure to prevent to detect the hypertension and treat to prevent the strokes, or we look after cholesterol and then prevent the heart attack. Similarly, we do one imaging test which is similar to the X-ray but much more advanced technically, is known as dual X-ray absorptiometry, which is shortly known as DAXA, in which a person lies on a machine and the imaging are done on the hip and the spine, and you got certain scores, and if scores are below certain threshold, then you are called osteoporotic. The basic thing is it tells you that you are high risk of fractures, so that appropriate measures can be taken at an early moment and fracture can be prevented.
Sure, we have just mentioned about DEXA, sir, and also along with it, do we have any other clinical development that you would like to share amongst our endocrinologists?
Well, we have been knowing that calcium and vitamin deficiency is rampant in our country, and that's majorly responsible for high prevalence of osteoporosis in our country. But at the same time, in the therapeutic armamentarium, we have got numerous drugs, both oral and injectable, which can really reverse the process to a large extent. The only thing I would like to mention that all these drugs are lifelong, because it's an aging process and we are trying to revert the aging process to a certain extent, of course only of the bone. So it's a lifelong treatment, so one has to be on regular medications for a long period of time and under clinical follow-up.
we've just mentioned about aging. So other than to aging, are there any other particular reasons to osteoporosis, and also is that common in our nation, or is there the right amount of awareness? What is the take?
There are multiple other clinical situations apart from aging. Of course, aging is osteoporosis, but there are many other medical conditions which causes increased fragility of the bones. One and topmost is type 2 diabetes, which you have got increased osteoporosis, increased fracture risk actually. You have got, then you have got use of glucocorticoids in general practice, where people take the glucocorticoids for small reasons for a long period of time. Other situations, rheumatoid arthritis, celiac disease, and many other medical conditions predispose you to fractures.
Sure. The treatment, let's talk about how can it be treated?
Well, there are three foundation stones of this treatment. One is basically taking adequate calcium and vitamin D in your diet and medications, maintaining adequate vitamin D levels in your blood. That's one. Number two, do maintain regular exercise patterns so that you are less risk of falls. In fact, the falls is a major thing which needs to be prevented, and at social level, at a domestic level also. Third is we have got various drugs which are oral or as well as injectable. All our drugs are very effective. In fact, the oral drugs, certain drugs are so effective that can reduce the fracture risk by almost 70%. Injectable drugs reducing the fracture up to 90% actually. So they are pretty effective drugs, but they have to be taken for a long period of time, and one need to have a judicious use of how much response it is having. So one has to get all these tests at DEXA has to be done at accredited centers where the standardization of these machines has been done properly and the reports are being interpreted properly.
Sure, certainly the drug monitoring needs to be taken care of. However, what long-term outcomes do we observe in these patients?
Well, it is great actually because aging is a multifactorial process. Your heart is involved, your lungs are involved, your bones are equally involved, you have too many issues, social and psychological. But I think when you're looking after these elderly citizens in a very proper way with adequate Medicare, they really live their life very happily. Though of course they require a little amount of medications here and there, they do wonderfully well.
Thank you so much, doctor. And lastly, a keynote message for our young endocrinologists watching us here on ESI TV. What would that one message be?
Well, the message to young endocrinologists is keep yourself updated, be honest, be human, and love the life.
That's simply put across. Thank you so much, doctor,
Thank
for
you.
coming on board with us here on ESI TV. Thank you.
Thank you very much.